नाजरीन आदाब, आप देख रहे हैं प्रोग्राम हेल्थ और हम, और मैं हूं आपके साथ आपकी मेज़बान हफ्सा खान। हेल्थ और हम महज एक प्रोग्राम ही नहीं बल्कि एक ऐसा प्लेटफॉर्म है जहां हम आपके सेहत से जुड़ी ज़रूरी मालूमात हासिल करते हैं ताकि आप और आपकी फैमिली एक सेहतमंद ज़िंदगी गुजार सकें। आज हम बात करेंगे दिमाग के कुछ अहम ब्लड वेसल डिजीज़ेज़ के बारे में, जिनमें ब्रेन एनोरिज्म्स, मोयामोया डिजीज़ और स्ट्रोक शामिल है। ये ऐसी कंडीशंस है जो अगर वक्त पर पहचानी ना जाए तो जानलेवा भी साबित हो सकती है या ज़िंदगी भर की डिसेबिलिटी का सबब भी बन सकती है। लेकिन अच्छी बात यह है कि आज मेडिकल साइंस में एडवांस डायग्नोसिस और ट्रीटमेंट के ज़रिए इन बीमारियों को बेहतर तरीके से मैनेज किया जा सकता है। आज हम जानेंगे इन डिजीज़ेज़ की कॉजेज़, सिम्टम्स, रिस्क फैक्टर्स, प्रिवेंशन और मॉडर्न ट्रीटमेंट ऑप्शंस के बारे में। इन तमाम पहलुओं पर रोशनी डालने के लिए हमारे साथ मौजूद है यशोदा हॉस्पिटल्स मलकपेट हैदराबाद के सीनियर न्यूरो सर्जन डॉक्टर बी जयानंद सुधीर। बहुत बहुत स्वागत है सर आपका हमारे शो में। कैसे हैं आप?
आई एम गुड, थैंक यू।
तो सबसे पहले शो की शुरुआत हम इसी अहम सवाल से करते हैं कि ब्रेन वेसल्स डिजीज़ेज़ जो होते हैं, पहले तो ये क्यों होते हैं एंड इनके कॉमन कॉजेज़ क्या है, उस बारे में आप कुछ हमें बताइए।
See, diseases affecting the brain's blood vessels can occur for anyone, right from infancy, childhood to elderly. And the blood vessels of the brain are end vessels. That is, they do not have additional blood supply. So, if you lose blood supply to one part of the brain, very rarely, sometimes collateral blood supply can reach that part of the brain to supply it. But once damage to the brain has occurred, it is almost always permanent. Recovery is very difficult. So there are so many diseases that affect the blood vessels of the brain. These include aneurysms, arteriovenous malformations, even atherosclerosis, that is cholesterol or fat deposition in the arterial walls. These can reduce the blood supply to the brain. There are some rare diseases also like Moyamoya disease, dural AV fistula, which also cause problems for people in the day-to-day lives. Aneurysms are the most dangerous of these blood vessel diseases because they usually strike as a bolt from the blue. The aneurysms are basically bulges or outpouchings, like balloon-like projections that come from the blood vessels, and these can expand and rupture. And rupture of these aneurysms can cause life-threatening bleed in the brain. Instantly, the patient can die. Some of these patients reach hospitals, and if they are in good grade, there is good clinical status, sometimes we may be able to salvage them. Other vascular malformations like AVMs, Moyamoya disease, also present with stroke. Moyamoya disease is interesting because it presents with stroke even in children. Small children less than 15 years can also land up in devastating stroke. Luckily, most of these illnesses are treatable. But why do these occur? The causes of many of these are not known. Some of them genetics are involved, some of them dietary patterns. Smoking is a risk factor, particularly for aneurysms. Environmental pollution, the type of food that we consume, all these have a bearing on the development of blood vessel diseases. Atherosclerosis leading to stroke is very common, especially in the elderly age group, but now it is slowly affecting even younger individuals because of our dietary patterns, eating junk food, fast food. All these can have its hazards on health. So atherosclerosis, which was commonly in the elderly age group, is now affecting younger individuals. People are dying out of stroke, out of cardiac disease because of atherosclerosis. So there are many causes of diseases that affect the blood vessels, but given an individual, it is sometimes difficult to pinpoint what exactly is the cause for the disease. And so we call these diseases multifactorial. Many agents, many factors may be responsible for ultimate development of the disease in each individual.
Yeah. So if you are going to talk about the symptoms particularly, so कौन से ऐसे symptoms है जो अक्सर लोग what they do is they try to not catch the symptoms as early as possible. So what are those symptoms जो लोगों में अक्सर दिखते हैं and उनको पकड़ना बहुत ज़रूरी है, उनको recollect करना बहुत ज़रूरी है और उन पर action लेना बहुत ज़रूरी है.
Right. So basically, when you talk about stroke, there are two types of stroke. One, because there occurs bleeding inside the brain, and the second type of stroke is because blood supply is insufficient to the brain. So these are classified like bleeding into the brain is called hemorrhagic stroke. Those strokes that occur because of decrease in blood supply to the brain are called ischemic strokes. The common symptom for these is more of individual specific or disease specific. So say for example, aneurysms can have severe headache. These patients describe this kind of headache as the worst headache that they have ever experienced in their life. So some of these, as I said, may be life-threatening. Patients may just drop dead because of massive bleed inside the brain. But fortunately, many of these don't usually present with catastrophic headaches. They might give some warning symptoms, like these are called sentinel headaches. Warning headaches may be confined to one part of the head, may be confined to one side of the head, and these warning headaches should not be ignored. These headaches have to get evaluated. Many times these are just ignored as migraine. It is better to get a basic imaging sequence like a CT or MRI to rule out any major cause of this headache. And if these are diagnosed at an early stage, they can be treated very well in advance and properly. There are ischemic strokes. The ischemic strokes that I said, they are caused because of decrease in blood supply to parts of the brain. So some of these may come again as a bolt from the blue. They may not be given any warning or symptoms that can warn them that you are going to develop a stroke. But there are certain illnesses like Moyamoya disease, particularly in children, when they develop transient strokes. These strokes may occur for a few minutes or few hours and then slowly disappear. So when they reach the clinical facility or hospital, the doctor examines and finds that the child is totally normal. So when the child is normal, they say that child is okay, will not require any investigations, and some of these are just brushed off as the child is malingering, playing around, not willing to go to school and just acting out an illness. So it is better not to ignore any kind of symptoms, be it weakness or facial deviation or speech difficulty or even uprolling of the eyes. All these can be warning signs for stroke. So it is better to not to ignore any of these symptoms and take timely action by getting into a medical attention facility immediately.
And if we are going to specially talk about children here, so is it possible that children also are prone to get these sort of brain diseases or any sort of brain vessel diseases?
Yes, definitely. Aneurysms are rare in children. Aneurysms, as I said, these are bulgings or outpouchings of the blood vessels which can rupture. They are very rare in children. Arteriovenous malformations are also not very common in children. But of late, we have to be very careful about this disease called Moyamoya disease or Moyamoya angiopathy. Earlier, it was thought that it is a disease that affects only the Japanese because it was in Japan in the 1950s where it was first described. It was very rare all over the world. Japan and East China were the areas that were territorially affected. In India, this disease was mostly confined to parts of West Bengal and Gujarat, but over the last decade, we have seen that the Moyamoya disease is actually increasing in numbers all over the country, and even in Hyderabad, there are cases that are coming up. Unfortunately, because the disease is rare, awareness about this disease is also insufficient for clinicians to pick up this disease at an early stage. Many of these are thought to be inflammations of the blood vessels, and treatment gets deviated to those channels where they get treatment for vasculitis or inflammation of the blood vessels. But it is crucial to understand that Moyamoya does exist in this community also. We should be aware that Moyamoya disease is affecting even people of Hyderabad. There are a lot of cases here also. Small children, last week we had a child hardly 4 years old having stroke-like symptoms. So early diagnosis prevents the development of a catastrophic stroke in such situations. So we should not ignore any warning symptoms of these. Children may present with just facial deviation. They may just fall down during playing because they develop weakness of one side. And one thing that can trigger such strokes in Moyamoya is dehydration. So if the child has been exerting himself or herself or playing or excessive crying or even eating spicy foods and hyperventilating, all those events can precipitate strokes in Moyamoya angiopathy. So the key factor once the diagnosis of Moyamoya angiopathy is established is to maintain proper hydration, because hydration will prevent strokes to a large extent in Moyamoya. But the ultimate treatment of Moyamoya is different. I think we will discuss it later in this session. So any such symptoms in children you should not be ignored. Transient weakness which recovers especially, and crying spells leading to weakness, even loss of consciousness, loss of speech, all these can be symptoms of stroke.
Yeah. So now if we are going to talk about diagnosis, so when a patient comes with these sort of symptoms and complaints, तो पहला step क्या होता है diagnosis का, and what is that procedure of diagnosing brain vessel diseases? Can you just explain us about that?
Yeah. So first, when the patient, specifically patient with Moyamoya angiopathy or Moyamoya disease comes to the hospital, the first point is to establish a diagnosis. A proper clinical history is very essential. And as I said, dehydration episodes can cause weakness in these children in Moyamoya angiopathy. In any other blood vessel disease, that is arteriovenous malformations or dural A fistula or aneurysms, the basic investigation that has to be done to understand the blood flow patterns in the brain is an angiogram. So, just like you do an angiogram for the heart, you can do an angiogram for the blood vessels. So, what is an angiogram? An angiogram is you pass a small needle or catheter into the blood vessel, inject a dye into the blood vessels and take series of X-rays and reconstruct these X-ray images to get the ultimate image of the blood vessels. So, it is called digital subtraction angiogram because once you do this angiogram, there will be lot of X-ray image of the bones as well overlapping with the blood vessels. So, digitally the bone part is subtracted and only the blood vessels are reconstructed and you can understand what is happening to the blood vessel. So, the angiograms will help us pick up all these diseases. Most of these diseases, the aneurysms can be picked up on angiogram, the arteriovenous malformations, the dural A fistula and Moyamoya angiopathy, all these can be picked up by the basic angiogram. But most of these patients are already prior investigated by a CT scan or an MRI scan to understand what is actually happening in the brain. So, these are basic investigations in cerebrovascular diseases. Further advanced sequences of imaging may be required for understanding how these blood flow patterns exist in the brain, whether some parts of the brain are deficient of blood supply or not. So, in case of an acute stroke, say a blood vessel gets blocked, what is usually done is, in order to expedite the treatment, we go in for a very fast scanning called the CT angiogram. So, CT angiogram will help us understand the blood vessels of the brain quickly. It hardly takes 5 to 10 minutes to complete the CT angiogram, whereas a digital subtraction angiogram will take more time. So, a CT angiogram will help the clinician understand where exactly the block is and what kind of treatment has to be immediately done for this patient. So, many of these patients recover immediately because of interventional procedures such as mechanical thrombectomy, where you can just pass a catheter up into the brain blood vessel, suck out the clot and re-establish the blood flow to the brain. Now, as I said, more advanced imaging techniques may be required in certain circumstances. When I talk about Moyamoya angiopathy, what actually happens is the main blood vessels that supply the brain from the heart, the carotids that go from the heart to the head through the side of the neck, and these are the main blood vessels, and there are two more small blood vessels that come from the back in the spine, and those are called the vertebral arteries. So, it is the carotid arteries that get blocked once they pierce the skull base and get into the brain. So, when they get blocked, it is not a sudden block, it takes time, it takes months to years for this block to develop. So, that is when these patients develop these ischemic symptoms or stroke like symptoms. And in order to understand what is actually happening, we do the basic sequences of MRI and then we go in for the angiogram, the digital subtraction angiogram, because we need to know what is the blood flow pattern, where the blood vessels are not supplying and whether any other blood vessels are taking over that region of brain that is deficient of blood supply. So, once this is done, we need to establish maps of the brain to understand which areas of the brain are actually deficient of blood supply. So, for this what we do is what is called the MR perfusion imaging, the magnetic resonance, the same MRI imaging, but a more advanced sequence of the MR imaging called the MR perfusion imaging. So, this will give us color maps of the brain. So, this will help us understand which parts of the brain are actually deficient of blood supply, and we try to understand whether these areas of deficient blood supply in the brain actually correlate with the symptoms of the patient, and this will help us guide the treatment also. So, these are the investigations, the basic CT angio, MRI, MR advanced sequences and digital subtraction angiogram. So, these are the investigations that are usually required for management of blood vessels of the brain diseases.
So, now coming for the treatment, after all these procedures, how is treatment decided? Like, is there any sort of treatment option that is similar to all the patients, or are there treatments based on their conditions? How is it? Just can you just give us a brief?
So, treatment for cerebrovascular disease is always patient specific. So, it is individual specific. No two patients can have an identical disease. So, let us start with aneurysms. So, aneurysms, as I said, they are bulges of the brain blood vessels, and these bulges can rupture and cause life threatening bleeds. So, we need to stop the leak somehow. And how do we stop the leak? There are 2 or 3 methods of treating this particular condition. So, one is by an open surgery of the brain. You just open the skull and reach the point where the bleeding is occurring, and then we place a metallic clip made of titanium alloy, and this is called an aneurysm clip, and the clip is placed in such a way that only the leak is contained, the aneurysm is clipped, and the rest of the blood supply to the brain is maintained. So that is an open surgical method of treating aneurysms. More advanced techniques or minimally invasive techniques are evolving, in which the same procedure that we do for digital subtraction angiogram, where you pass a catheter through the blood vessel, reach the brain through the inside. So it's just a puncture in the skin that helps us do this treatment. And using that method also, there are various ways you can treat aneurysms. One is by filling the aneurysm dome with coils. Coils are metallic coils. These are put into the dome of the aneurysm, and this will cause the blood to solidify or clot within the aneurysm, and hence the chances of rupture of the aneurysm comes down. And there are other ways we manage it through this route called the endovascular route. We place stents, just like you have stents for the cardiac blood vessels. You have stents and flow diverters that can be placed within the blood vessels of the brain, so that the blood is streamlined through these stents and does not get into the aneurysm. And more modern techniques like web device are also coming up, and these are all patient specific. That is, given a patient's aneurysm condition, that is what decides the treatment, the particular anatomy, the shape of the aneurysm, all these decide what kind of treatment is to be done. A third method of treating these aneurysms is a more advanced technique called brain bypass surgery. It's very risky procedure. Just like you have a bypass surgery done for the heart, you have a blood vessel of the heart that gets blocked, and in order to circumvent the block, you do a bypass. You place another blood vessel, you stitch another blood vessel across the block, so that blood supply across the block is ensured to the rest of the heart. So similarly, a bypass procedure is possible in the brain also, and this bypass procedure can be used in the treatment of aneurysms which are not amenable to the first two methods, that is open surgical clipping or the endovascular, the catheter based, angiogram based treatment of the aneurysm. So in complex aneurysms, sometimes we may have to do what is called the brain bypass surgery. So the other conditions that require treatment, the arteriovenous malformations, those are actually abnormal connections between the arteries which carry the pure oxygenated blood and the veins that carry the impure deoxygenated blood. So if there is an abnormal connection between these two blood vessels, there can be a mass of tissue, blood vessels that can bleed. Because the blood vessels are not strong enough to contain the blood within it, they can bleed and can cause problems. So such arteriovenous malformations are also treated by open surgical methods or endovascular methods, wherein you can put a catheter into the feeding artery of the arteriovenous malformation and block it from inside using various methods, various substances like tissue glue, or even coils can be used to block the feeding artery, so that the arteriovenous malformation is controlled. And further advanced treatments like MR Linac, radiation based treatments, MR Linac, gamma knife surgery, all these can also be used for treating arteriovenous malformations that are very complex, that may not be amenable to the set methods of treatment like open surgery or endovascular surgery, or even as a primary modality of treatment. Some of these AVMs arteriovenous malformations can be treated by radiation based procedures. Now coming to Moyamoya angiopathy, the problem is that despite 7 decades of knowing that such a disease exists, nobody knows why the disease occurs and what causes the disease to occur in individuals. And because we don't know what is causing the disease, sometimes it's difficult to prevent and difficult to cure the disease, and hence the treatment is also difficult in terms of medical management. It is difficult. So what is usually done for the treatment of Moyamoya angiopathy is again the brain bypass surgery, because the main blood vessels that supply the brain through the neck, that the carotid arteries, are getting blocked. So we need to give blood supply to the brain through some other route. And for this, the best method of treatment of Moyamoya angiopathy is by doing a bypass procedure. For this, we take a blood vessel that comes from in front of your ear, that is the superficial temporal artery. It goes up like this along your skin of the scalp and then supplies the skin. So we harvest that small artery, which is hardly 1 to 2 millimeters in diameter, and we connect it to one of the blood vessels in the brain. So despite the block in the main vessel, the brain is able to now get blood supply through a bypass artery, and over time this bypass artery will become big in order to supply blood to larger areas of the brain. Sometimes Moyamoya angiopathy occurs in very small children, or in certain situations we may not be able to get a good artery for doing the bypass procedures. In such cases, what we do is called an indirect bypass procedure, wherein we place the tissues around the skull, that is the covering membranes of the brain, the covering membranes of the skull, the tissues under the skin of the scalp. All these can be used to supply blood supply to the brain, and we surgically place all these tissues onto the brain surface so that new blood vessels will grow from these tissues and reach the brain, so that they are not deprived of oxygen anymore. So ultimately this results in treatment in the sense that these ischemic areas, that is the parts of the brain that are deficient in blood supply, ultimately get good blood supply, and these patients go on to lead very normal lives. Some of these the patients who have been treated for Moyamoya angiopathy have done very well in life, and some are pursuing PhD programs as well. So despite having a decreased blood supply in the initial stages, the brain does catch up. There is a lot of plasticity, neuronal plasticity, and capability to readapt to circumstances, so that the patients are able to lead a normal life. The fourth entity that I told you is dural AV fistula, in which again there is a small abnormal connection between an artery covering the brain's the blood vessels of the brain's covering membrane called the dura, and this feeds into a vein, and hence there is a lot of engorgement of the blood vessels within the brain, causing a lot of symptoms like stroke. So in order to treat these, again the endovascular method, the catheter based treatment, wherein you block the artery that is feeding the dural AV fistula, or even open surgical methods are also available to treat these conditions. So advanced medical treatment is available for treatment of almost all kinds of cerebrovascular diseases.
Yes. In the end of the episode, what would be that one awareness sort of message that you would convey to all the viewers who are watching you?
Right. So the most important thing is to take cognizance of even the most minute symptom. It can be a headache, it can be a recurring headache, it can be just a transient weakness, it can be just a transient deviation of the angle of the mouth. All these symptoms should never be ignored. And the second thing is that hydration, drinking water, is very important for maintenance of good arterial network. The blood supply within the brain has to be well smoothened by hydration techniques. The blood will remain fluid, and the blood will flow very well if the blood is remaining fluid. So adequate hydration is very important in preventing these kinds of cerebrovascular diseases. Apart from genetically determined cerebrovascular disease, there are some diseases that can occur because of excessive smoking. So lifestyle changes are very important. Smoking is to be avoided at all circumstances, and management of lifestyle diseases, hypertension, obesity, all these, diabetes mellitus, all these can help a lot in preventing and controlling cerebrovascular diseases. And again, the dietary management, more healthy diet, less of fast food and junk food.
Thank you so much for being here with us today and sharing this informative part with us, because I feel brain diseases are some sort of thing that should be considered very seriously. So thank you so much for sharing this information with us today.
Thank you.
नाज़रीन, दिमाग हमारे जिस्म का सबसे अहम हिस्सा है और इसे सेहत का ख्याल रखना बहुत ज़रूरी हो जाता है, और ये हमारी ज़िम्मेदारी है कि हम इसका ख्याल रखें। आज के एपिसोड में बस इतना ही। मिलते हैं अगले एपिसोड में एक नए हेल्थ टॉपिक के साथ। तब तक के लिए मुझे दीजिए इजाज़त, और आप बने रहें मुंसिफ टीवी के साथ।